country is now seeing the highest number of new COVID-19 cases since the virus first reached American shores back in March.
Now we're facing a third wave, trending to be more dangerous than any we have seen before.
This is a coordinated activity happening across this nation, and so Black people are in a state of emergency.
California has seen record-breaking wildfires this month.
The heat in triple digits. 3 of the 4 largest fires in California history are burning right now.
Hello, my name is Dr. Shauna Springer. I'm the Chief Psychologist for Stella and one of the nation's leading experts on psychological trauma. This video will describe an innovative method for addressing symptoms, a procedure called Stellate Ganglion Block. This video will illustrate how the procedure works using animation. You will also hear from patients who have had the procedure who describe their experience. When any new procedure, intervention, or treatment has not reached a tipping point in general awareness, some people may view it as new or fringy. In fact, SGB has been used since the mid-1920s, almost 100 years. It has long been documented in medical literature as a treatment of choice for certain pain-related conditions, typically offered by anesthesiologists. SGB as an intervention for trauma symptoms arose from a line of thought that views PTSD as a largely biological condition, with psychological and emotional components that are maintained by a shift in normal biological functions. In other words, after trauma exposure, our baseline functioning may change in dramatic ways. In some cases, we may become stuck in fight or flight mode, which can be observed in certain types of brain scans. It may be helpful to think about the sympathetic nervous system as being somewhat like an engine. Under normal conditions, we are in neutral gear, a relatively relaxed state not associated with feeling threatened. However, extreme stressors can shift and lock us into a higher gear, where we may remain for years or even decades. Many of my patients have described this state as feeling constantly revved up and being unable to throttle down. Common indicators of this altered biological state include symptoms like disrupted sleep, anger attacks, overwhelming panic, difficulties concentrating, a feeling of being constantly on high alert, and a strong startle response. In other words, the hyperarousal cluster of trauma symptoms. Many who suffer from these symptoms may not meet criteria for a diagnosis of PTSD. However, these symptoms can have a devastating impact on the quality of our life and our relationships.
What I've used to do before is wake up, take my kids to school, come back and lay down. Now I get home and I find something to do outdoors. Like I refuse to go inside until I need to. And just being able to enjoy the sunlight, it's just amazing.
For this reason, in my work and my writing, I refer to this state as chronic threat response. Based on the research of Lynch and colleagues, it seems that SGB most directly targets the hyperarousal symptoms that characterize the chronic threat response I've observed in my work. SGB involves injecting a widely available, commonly used anesthesia into a bundle of nerves in the neck, just above the collarbone. The injected medication has the short-term effect of soothing and resetting the overactive nerves. To return to the earlier analogy, SGB seems to manually pop a stuck gear back into neutral. This animation shows how SGB is performed.
Evolution of sympathetic ganglion blocks have been a prolonged period. The latest and the best approach currently is ultrasound guidance, which is an amazing way to be able to see the blood vessels as well as the nerves, which makes it much safer and more effective. The levels which are done originally were C7, C6, which is a base of the neck, and over a period of time, the protocols have been evolved to include C6 and C4, C3 level, which is another ganglia, giving a better reboot and better effects clinically.
The first physician to ever describe the use of stellate ganglion block in association with emotional trauma presented a case study in 1990 of a 15-year-old girl who had been shot. She was reluctant to engage in psychotherapy to address her symptoms. The researchers clearly noted that SGB made the patient much more willing to engage in therapy. Thus, from its inception, SGB has held the potential to help patients engage and fully benefit from psychotherapy. Dr. Eugene Lipov is credited with making the connection that stellate ganglion block may directly address symptoms of trauma, based on a study that documented the successful treatment of social phobia through a surgery to treat excessive sweating that cut the nerves in the part of the body that controls sweating. Lipov's discovery that SGB may improve trauma symptoms is documented in his 2008 case report of a patient who had survived a robbery. Here's what Dr. Lipov had to say about this case.
I called my brother again, and he was able to send me a patient that had severe PTSD from being attacked during a robbery. We were able to treat him, and then following that treatment, we were able to publish a paper that then led to a number of people looking at this and accepting our approach, especially military environment. A number of institutions were able to replicate this, and it led to a recent publication in JAMA in 2019, validating its efficacy.
Many of the other pioneers who have advanced SGB for emotional trauma have been active duty military physicians, operating out of Tripler Army Medical Center, Fort Bragg, Walter Reed Medical Center, the U.S. military base in Landstuhl, Germany, and Madigan Army Base in Fort Lewis, Washington. Physicians operating within the Department of Veterans Affairs have also helped advance the practice of SGB. Due to the efforts of these pioneering physicians, SGB is now a go-to intervention within several military medical facilities and is described by the Center for Compassionate Innovation within the VA as a safe and ethical treatment option for those with trauma. I first became involved while serving at the VA when a former Special Forces medic requested SGB. He had worked very hard in therapy, even taking a sales position at a local hardware store in order to expose himself and hopefully habituate to an extremely stressful environment. Yet even after months of intensive therapy, his trauma symptoms were still impacting his quality of life. Like many who suffer from trauma, his life had narrowed to a limited set of activities. He was unable to consistently feel warm and loving feelings for his family, and he would jump out of his skin whenever his granddaughter came up behind him. I collaborated with a medically qualified physician to treat him. I stood right next to my patient in the operating room, and I sat with him in post-op when he cried tears of relief to feel released from his constant state of fight or flight. I followed him in several other cases for months after their SGB procedures and received convergent reports from their loved ones about the profoundly positive shift in their quality of life as a result of SGB. Despite the fact that thousands of patients have found relief from anxiety with SGB, relatively few trauma sufferers are aware of it. A major reason for this is that research and practice have mainly occurred within active duty military contexts. As I just mentioned, with the exception of procedures performed by Dr. Eugene Lipov, the majority of SGB procedures have thus far been conducted with members of the active duty military and veteran populations. This has led to a nearly total lack of awareness of the procedure within the civilian population. In other words, SGB has not yet hit a tipping point of awareness in the civilian medical community. In comparison to other invasive interventions, the risk of negative outcomes is low. In a 1992 survey of 45,000 individuals, the incidence of severe complications was 1.7 per 1,000 procedures, with no fatalities reported. Additional safety precautions have been developed since this study. To ensure correct placement of the injection, medically qualified providers use ultrasound, fluoroscopy, or computed tomography to help visualize the injection area. One of the greatest barriers to understanding the potential value of this procedure is widespread misunderstanding about the concepts of FDA approval and off-label use. Legally, those who provide SGB for trauma symptoms are required to state that SGB is not FDA approved for use with trauma symptoms. The phrase "not FDA approved" raises the specter of an unsafe or dangerous procedure or something that is untested. As mentioned, the medications used are FDA-approved anesthetics, and SGB has been used to treat pain conditions for nearly a century. For the past decade, SGB has been applied to symptoms of trauma in the same way that aspirin is used to reduce risk of heart attack. Aspirin is also not FDA-approved when used in this way. Like SGB, it was also primarily developed to treat pain, but has shown clear promise in many documented medical cases for reducing cardiac risk factors. Research continues to emerge on this new application of a long-established procedure. Outcomes of a recent multi-site randomized clinical trial published in JAMA Psychiatry are promising. Researchers describe stellate ganglion block as a safe, routine procedure and state that results are congruent with several case reports and case series that have shown improvements in PTSD symptoms after SGB. In the literature across articles documenting case series outcomes, stellate ganglion block has a success rate ranging from 70 to 75% on average. When SGB works as hoped, positive effects on the biological symptoms of anxiety are immediate, and results often last for periods spanning several months to many years. I have stood next to several of my patients in the operating room while they have had a stellate ganglion block. Within minutes of the injection, they have said things like, "I feel like myself again for the first time in over 20 years," or "It's like having a 1,000-pound weight lifted from my chest," or "I can't remember the last time I actually felt calm and happy." As a theme in the months following this procedure, they say that SGB has given them a second shot at a happy life.
Just for the few guys that saw me this morning and to say, what happened to you? It's awesome because I want them to see that, and I just pray that it does for them what it did for me.
In conclusion, stellate ganglion block offers promise for giving people exposed to trauma from all causes a second shot at a happy life. It's a new frontier for trauma treatment that could be game-changing for many who suffer. And for this reason, it's something that those of us in the mental health professions should become aware of. Thank you for taking the time to take this course and for your commitment to learning about innovative developments in the care of those who suffer from trauma symptoms.